I've been aware of some occasions where documentation about actual patient visits were done when in fact the patient visit was never made. So honesty is extremely important. You will also be privy to information in the home, discussions that happen within family members. There might be money, jewelry, and so forth laying around. So honesty and integrity is an important piece when you are working so autonomously and independently. Know the limits of your care is another important quality and characteristic of being a home health aide. You want to avoid any possible liability. Sometimes you are asked by patients and families to do things that are not within your role as a home health aide. For example, you might be asked to take the patient to the store or take them to pick up some medication. That's not acceptable for you to drive their car or to take them in your car. If you had an accident, they were injured, there might be some liability issues. They might also ask you to sign some checks for them or make out bills. Those are responsibilities that should be reported to the nursing supervisor and arrangements made for other assistance for the patient to be given. Another is to set realistic boundaries. You have a limited amount of time for each visit, so you have to be able to work efficiently but be realistic. Sometimes patients and families want you to do additional things that were not necessarily on your assignment sheet, and you will have to determine, first of all, if it's within your role as a home health aide and whether or not you have the time to do that. The home environment varies greatly. You will go into some homes that are very small and some that are literally mansions. Some are very clean and some have very offensive odors and are very, very dirty. Each person and family, regardless of the size of their home or the conditions of their home, need to be treated with respect, kindness, and dignity. One of the ways I, in a home health agency, as a home health nurse, has shown respect is in the winter months when snow and ice or mud could be brought in on shoes, is to bring an extra pair of slippers along or little footies and putting those on and leaving soiled boots or shoes at the entrance to the home. This is a way that we can show respect. Another way to show respect is to ask permission before you assume that you could put your coat down on their table or hang it up. Ask them where they would like you to put those things. Don't make judgments about an individual's lifestyle, their habits, religion, or culture. It may be different from your own, but respect that that works for that family. And always protect the family property. Be careful when you're doing light housekeeping not to break precious valuables. And if you have to move things for one reason or another to provide the care, be certain that you put them back exactly where you found them. Be aware and sensitive to the function of the family. They may have values and behaviors that are different from your own. And learn to accept the family's response to illness. Sometimes family members are providing much of the care to the patient and they are totally exhausted much of the time. They're under a great deal of stress because of the illness that the individual is having. They might strike out at you verbally, and recognize that sometimes people respond that way when they're under a great deal of pressure. Develop a good working relationship with the patients and families. become a really good listener and ask questions and seek to understand what they are trying to convey. Don't get involved in any family conflicts that you may become privy to. The exception, however, might be if you become aware of any verbal, physical, or emotional abuse that may be occurring or that you suspect may be occurring. You have a responsibility to immediately report that to your nursing supervisor so that that can be addressed immediately. Careful written records of the activities that you are doing must be kept. The format for record keeping really varies a great deal from agency to agency. Some of the common forms, however, that you would be utilizing would be a time and travel record. I mentioned that earlier. That would be the amount of time that you spend in the patient's home, as well as the distance that you drove from that residence to the next one that you're going to. And also patient care records. These patient care records would be your home health aide assignment sheet. It could be the care plan and other important documents that are all kept within a folder. This folder is placed in a convenient spot and is developed by the professional nurse for your use when you are in the home. It's important with all of these records to be accurate and to keep your handwriting neat and legible. It also must be complete and always up to date. That means as soon as you leave the residence, do your documentation on that particular individual. Don't trust your memory to complete it at the end of the day. Working with patients and families in their natural home environment presents a different set of challenges than it does if you're working with patients in the hospital or nursing home. Home health aides, through the type of personal care they provide, have an opportunity to significantly influence the quality of care that patients receive.